every state's population is 20 to 25% children. So if you don't have any opportunity to vaccinate children, it's virtually impossible to get to herd immunity.
The Medical University of South Carolina is one in a group of research sites across the country leading a COVID-19 vaccine pediatric trial here in the Lowcountry.
There's the second arm, the third arm, the fourth arm, and the fifth arm. This takes us all the way to June 8th, but we still have arms 8 and 9, 10 and 11, 12 and 13 to go. And the ability to do vaccine trial for COVID in small children, ages 6 months to 12 years, is just starting to get underway. And approximately 100 sites have been selected for the Moderna trial, and MUSC is one of those 100 in North America.
Dr. Andy Atz, chair of Department of Pediatrics, serves as principal investigator for the Kid Cove study at MUSC. 7 other physicians are part of the investigator team, and there are 8 to 12 study coordinators that will devote time to running the study overall.
The trial itself is incredibly complicated, specifically meant to be very safe for children, so it has a very slow ramp up. So we have not started giving vaccine out yet, but we will be part of the 100 that ultimately are able to deliver lots and lots of vaccines come the summer.
Selected sites are tapped for specific phases, and hundreds of families are interested.
Through almost word of mouth, we've been able to attract hundreds of interested families. So I think our issue is not going to be that we don't have enough interested parties. Our issue may be that we have far more interest than we may be able to ultimately enroll in the study.
More than 6,700 children will be enrolled at some point during the lengthy trial. During 13 different arms or phases, different age groups at different dosages. During the first phase, a different dose is tested in 3 separate age groups: 6 months to 2 years, 2 years to 6 years, that's just before school age, and 6 to 12-year-olds who are prime school age children.
The data is looked at for safety. If there is considerable issues with safety, then the trial stops. I think that's the other thing that we can give to families, is that this is really set up in a way that there are what we call in clinical research stopping rules, that if there is a concern that there really is a deleterious safety signal, the whole study will be stopped. Thus far, across the 100 sites, there have only been 75 children enrolled, and that's predicated on doing this very slow with one particular dose in this 6 to 12-year-old group thus far.
MUSC is setting up a remote site for this study at the Summey Medical Pavilion in North Charleston.
How long will the actual study take?
Yeah, I think this is another fascinating thing because this really does involve 3 different age groups. The study right now is projected to ultimately take about a year from now to be completely done.
Study participants do receive compensation, $100 per office visit.
People will not get rich with this, but the idea of patient compensation for studies that require you to come in person for a visit is very common in both adult research and in pediatric research.
And doctors here at Coastal Carolina Research Center also have a pivotal role in putting the pieces to this puzzle together. They are ramping up for their clinical trials for 2 pharmaceutical companies for children 12 to 17.
So we have, as I said, 2 studies coming up. One is with Johnson & Johnson, which is a familiar name to most folks, and then the other is with Novavax. And they're both going to be starting in the next few weeks.
Dr. Cynthia Stroud is principal investigator.
Between these 2 studies in the United States, it'll be between 3,000 and 4,000. But at our site, maybe about 100. We've actually had a lot of parents from our adult studies say that they would like their children to participate. So we do have a list already of people who are interested.
One of the studies is 15 months, the other is 2 years.
So there's quite a bit of oversight, a lot of monitoring along the way that help keep volunteers safe.
Dr. Stroud says while there is always a chance of an adverse reaction during clinical trials, the benefits to finding a safe vaccine for children far outweighs the risk.
Vaccinating kids is part of the puzzle. that needs to be figured out to help get us back to a more normal life. It's one of the things that's going to help us get to the end of this pandemic. Very thankful for the people that stepped up to volunteer for those studies, because that's the data that was used to get those vaccines approved, and they're now saving lives.
Octavia Mitchell, Count on 2.